that is like the trillion-dollar question, and it's such a good and important one. I think that the priorities of Western medicine are very much the things that I prioritized as a trainee, which was fixing things, diagnosing things, making sure that we saved and prolonged life regardless of its quality. And we only really get to know who lives in that body that we are trying to save when we have the time and space and inclination and training and desire to really know who that person is. And I wish that I could say that I had the absolute magic answer, but I will tell you this. I think many of us think, oh, it's going to take a long time to talk to people about matters other than, okay, here's your symptoms, here's the test, this is what I'm going to do if you have pneumonia on your chest x-ray. But in fact, if we prioritize relationship building with our patients early on, what we actually find is that as time goes on, if you have the luxury of a continuous relationship with your doctor, that it isn't one big chunk of time. It's getting to know somebody over time. And even if it means saying to somebody early on, my priority is getting to know who you are, there's going to be times where we're going to have more time to do that and times where we won't have as much time. But I want you to know that part of treating you means treating you, not just treating your symptoms or what's on your lab tests. And I think if we reprioritize that in training onwards, we can actually teach people how to communicate concisely, effectively, and compassionately, because most of us, right, we want our doctors to do everything possible for us. Isn't that right? Everyone would raise their hands in agreement. Part of doing everything for somebody is knowing who they are. Part of doing everything for somebody is listening to what matters to them. And doing that is possible if we train people how to do it and understand that communication is just as important a procedure as learning to do a surgery. Yes, so I think it's interesting because we certainly do not have all of the answers. Let me just speak for all of medicine and say that. I feel like I'm standing on solid ground saying we do not know everything and have all the answers. And I do think that part of what it means to go to a doctor is to have your expectations of them and articulate them and see what they have to say and respond. Here's how I'm hoping you can help me, right? I know that you can diagnose me. I know that you can give me medications, but it's also really important for me to feel seen and heard by you. Here are the ways that I tend to feel seen and heard. I know what I'm saying might sound totally crazy, but I think that in this day and age, especially with all of us in medicine under so much pressure and scrutiny, seeing more patients with less time because of things like insurance companies and private equity buying up practices, which I could give a whole other Chautauqua lecture on, which would be very depressing. But I think it's on us as patients and families to say, here's what I'm hoping you can do for me. I value you. Here are the ways I can be seen and heard. Here's the type of communication I respond to. Is that something you can do for me? Or also, I believe that my spiritual counselor is a big part of my medical care. Could I bring him or her to our appointments? And helping your doctor understand the other types of treatment and healing modalities that matter to you. Because many of us will be open to it and probably feel a lot better that we have teammates along for the ride and taking care of you. I'm sorry I've had my back to the side for a while. I don't know why. It's not because I don't love you. So. Children are the ultimate representations, I think, of wonder and awe and of being untouched by all of the challenges of the world. I, in my current practice, do not take care of young children, but I do take care of young adults, so people from age 18 upwards, and I take care of a number of people who have young children. And so I get to I have the privilege of seeing the way children regard death at different ages. I do think that children have a sense of what it means to lose something and what it means to have something forever. And I think that many of us would be well placed to go back to what it means to be young and to see the world with unsullied eyes and to understand that what we have now may be with us for a short period of time, but let's make that time meaningful. And I think that that's something that's a source of wonder and awe in and of itself. I see a lot of my colleagues, and I've done this myself, trying to protect younger people from the reality of death and dying because we think it's before their time. Or we want to have them live as long as possible, but withholding has its own kind of magnetic force. And people know, even before you think they know, that they're sick and they're dying, because they're the ones living in that body. They're the ones watching their parents get sicker. And so I think what it means to think about with a childlike sense of wonder and awe, approaching death and dying in conversations that way, a lot of it means telling the truth. And I think that's something that we all need to do, to learn how to do in the simple ways that we talk to children, because children understand things that are very complex in very simple ways. And so much of the hardest conversations become harder when we're talking about death and dying because we're making them harder.
Yes.
And if we try to explain things in kitchen table language to a child, and to look at others as though they are just looking at wonder and amazement at what's about to change in their lives, we might find a new way into a tough conversation. I'm glad somebody brought that up, because I have a lot to say on this topic too, but I very much believe that these ancient medicines have a way of helping us encounter what we cannot ordinarily encounter through conversation and therapy. I think that the power of psychedelics is that they take us beyond this world to a place where we come from that we don't maybe realize that we've come from, that we are, as Lord Krishna says, all coming from a source, all manifestations of the source, and all going back to the source. But words only can get you so far. The power of psychedelic therapy is that it can allow for a change in your neuroplasticity that opens you to a wonder and an awe of who you really are in a way no amount of talk therapy, no amount of reading can do. And so I think we have studies showing that patients with advanced cancer took a certain amount of psilocybin or magic mushrooms and really lost their fear of death, their death anxiety, that horrible, just disfiguring anxiety that keeps us solid instead of moving through our reality and moving through our emotions. And I think the other big power of psychedelics is they can return you to your body. Many of us live such an ungrounded existence where we're in our heads and we're not feeling. We're not feeling if we scrape our elbow and are bleeding, but we're also not feeling where our anxiety and our fear shows up. Psychedelics allow for that reconnection. And I think in that reconnection, they allow us to see that everything that we think we have to fear is not something we have to fear. So I am a huge proponent of the safe use of psychedelics and ongoing research about their power, not only for the people that are dying, but the people who are going to lose the ones they love. So I think faith is one of many lenses that people use to look at the world and to understand their lives. And it gives them a language with which to explain what's befallen them and the meaning that they make of it, right? So much of life is meaning making, and religion and faith are ways to make meaning of or understand what happens to us in a different way. So faith is a huge part of what many of my patients cling to and reflect on as they're going through an illness experience. Sometimes faith is something they come to after having not really understood their relationship to God or the universe. And sometimes faith is something they step away from. And sometimes it's the creation and the recreation of those bonds, shifting relationships to faith and spirituality that happen. Sometimes people are born Christian and become Buddhist in their journeys. So it's a really important way of understanding how a person thinks, how they interpret what happens to them. And I think in palliative care, so much of what we do is medicine, but we are also, I think, ministering and helping people to hear themselves when they're talking about loss and they're talking about God and what it means to them. I definitely have patients who are atheist as well, and will firmly tell me that, because some part of what we ask is, tell me about your spiritual life if you have one. And they'll be very clear, I don't believe in God, I believe this is the end and there's nothing else after this. And that too is their lens on the world. And so if I'm trying to get to know how somebody sees themselves or sees the world, no matter what label they're using, I'm less interested in the label and more interested in what their self-definition does for them. What does it mean to be a person who follows Jesus? What does it mean to be a person who practices Judaism? What does it mean if you're a devotee of Lord Shiva? And it's that meaning that I'm after, less so the label, because the way they think of and define and use that meaning tells me so much about who they are. And that's really what people want, right? Don't we all want to be seen and heard and understood? Isn't that a basic human need? And it's something that I wish would become more a part of how we take care of patients and each other. So I think we live, like our society, and I would say unfortunately many others now, really do think of disease as a battle to be won, right? And I think we have a very militaristic approach to a lot of different things in our societies, but I think unfortunately this kind of idea that either I'm a fighter or I'm a quitter. If I survive, I'm a winner. If I die, I'm a loser. These are real toxic binaries that do nothing for the person that we're talking about and doesn't really respect their experience or really enable us to hear their wishes. Because it really, I've seen time and again that it has nothing to do with how hard you want to fight. It has nothing to do with how much you want to live. Hope matters. Faith matters. But at the end of the day, what binds us to the earth is biology. And sometimes, no matter how much you want to fight and overcome what you're facing, it's your body that may not be able to match the ferocity of your will. And when I think we get into these ideas of do everything or you're a quitter, or I'll hear colleagues say things like, I'm going to give him more of X or Y therapy because now's not the time to give up. Just the assumption underneath that sentence comes through in a lot of different ways that we interact with each other and with our patients. And I don't find it empowering. I think some people have told me, Dr. Puri, I really disagree with you. I think thinking of myself as a warrior helps me get up every day. And to them I say, thank you for telling me what the word means to you. And that's so much of this work, is helping people to tell me what they really mean. Because when we say I'm a fighter and I want everything done and I want a miracle, those words are standing in for something that requires a lot more words than the word miracle. It means saying, tell me what that looks like to you. When you tell me that you're a fighter, tell me what that means to you. Tell me what you're fighting for. When you say you want everything done, tell me what that looks like. And what if we're doing everything, but your body is showing me that it is dying? And so the words themselves are just portals. So there's a movement of death doulas that are sort of like doulas at birth, where they can help with various aspects of dying, everything from helping you write an advance directive to planning an awake funeral, which is something that a death doula did for a patient of mine. And I do think that we need all of different kind of professionals to help in the work of death, because it is a lot of work and it is not just the domain of Western biomedicine. So I think everything from music therapists, who can be an extremely helpful part of the death and dying process and of the process of easing suffering, all the way to having doulas involved, is just giving you more support as you're going through an incredibly big transformation. I am, and I absolutely think the Conversation Project is one great set of assets that you can look at to have some of the questions to ask people you love, not about necessarily, if your heart stops, do you want CPR, right? Because I think that's not the right question. The question is, who are you? And what type of life would you want for yourself if you got sick? Because when we go into individual decisions, like, do you want X or Y? I don't know whether my mom would have wanted to be on a ventilator. The question is, what type of life would your mom have wanted to live? And that's where we begin with the people we love. Because if someone says to you, I would never, like, a quality of life for me is being able to be awake and aware of the people around me and to be able to talk to them. If I can't do that, even if I'm okay being bedbound and need a lot of help getting around, but if I'm not awake and aware and I can't talk to you, I don't know what my existence would mean. Then you know that. Then some of the answers about, if you were to go through CPR in your condition, and your condition is irreversible, and we did this anyway, the chances that CPR would give you that level of awareness and the quality of life you would want is not very high. So the question isn't, do you want CPR or not? The question is, will CPR help you live the life you want? And so the place to start, which I encourage people to think of as coming from a place of intimacy, wonder, and curiosity, is tell me how to be your voice. And that takes the fear out of filling out those documents and makes it just a way of re-getting to know somebody that you love so that you can be their voice. And I also, when we go to the Conversation Project website and look at what they have to say and look at the documents, remember that the earlier you start a conversation, the better for you and for the people you love. That filling out those documents is such a relief, not only because the document's there, but because you've had the opportunity to understand the type of life you want to help somebody live who you love very much.
So that website is the Conversation Project.
I don't know if that's the exact type, but the Conversation Project is the name of the group. And there's many, many others, but that's a good one to bring up. And whoever the ER doc is, thank you for what you do, because it is really hard to have to help people make those decisions in the throes of a crisis. And part of the reason, the other group you're helping a lot when you have these conversations is doctors and nurses, because we struggle also tremendously when we don't know what to do or how to guide, and there's 30 seconds between either needing to intubate or having someone stop breathing. So it is a kindness for everybody. So the book is essentially a braided memoir. So I talk about growing up as the daughter of Hindu parents who also raised us with a blend of Sikhism and Buddhism, both of which are very closely related to Hinduism. And it's about growing up as the daughter of immigrants, but also growing into my role as a palliative care doctor and really never anticipating that I would want to go into medicine and then tend to people who medicine considers essentially incurable. Don't doctors become doctors to save lives, right? This is what my own parents were very confused about. Why would you want to do this? And it's about why I came to do it and why I came to find myself and my purpose in that work. And I tell the stories of my patients and their families, but I also tell the stories of my family. and of my parents who really truly came from nothing. Like, I've seen where they came from, and it was really their faith in God that barreled them from those places where they grew up into the careers they have, into the lives they have, and how they were fearless in raising us to remember where we came from, but to also remember that we are no different than the people around us, and that we are God, and the journey of this life is to realize that. And the book is really like, I just left my job in Massachusetts recently and moved home to California to take a new job, and I'm staying with my parents right now in the house where I grew up. And I'm like walking around, like I've started to take my dog for walks at my intermediate school, my elementary school. And I remember thinking back then just how much I wanted to write, how much stories saved me when I was a lonely kid, a really nerdy kid. I know that's probably shocking, but very nerdy, very lonely, and very much like the characters in the books were my friends, and I wanted nothing more than to be able to write. I never thought I could do it. And so I think of my book almost as like, it in and of itself, that it exists as a miracle. And I'm so thankful that God gave me the ability to do it, because the mission of the book is to help people. And I hope that it does. It's called That Good Night, Life and Medicine in the 11th Hour. And like I kind of said in the talk, like, I am no master of the things that I'm talking about, because I think part of the purpose of life is to grow into that ability. So I'm very humble about what I'm a master of and what I am not, which is most things. I have been blessed with a really wonderful brother who's here today, who is my best friend and who is a big source of support for me, as are my parents and my friends and my dog, Ruhi. And I think having, like, a part of my resilience is talking to and leaning on them. I also do a lot of exercise and yoga, which is important to me. I read a lot of trashy celebrity magazines just because I'm from Los Angeles. And you can take the girl out of LA. You can't take LA out of the girl. And so I genuinely, if you want to see my computer browser, this is true, usmagazine.com, also known as Us Weekly, is something I indulge in. I also really love movies and TV and the things that bring us all joy, although one may say, why are you watching Ozark for like the 5th time in a row? That is no source of joy. And I pray. I pray a lot. I make it part of my walk in the morning with my dog. I talk to God. I ask him to help me. And I try to remember that I'm only human. And I'm super hard on myself. And I have no problem being vulnerable and admitting that among my many flaws. But I'm really trying hard at this point in my life to be gentler. And that, I think, is a part of resilience, is learning that you can be gentle with yourself, and that is also a powerful way to live.
So in short, your inner work, and you don't do it alone, and have a bit of fun. And I think this may be a first, the only time in the Hall of Philosophy where you were encouraged to subscribe to Us Weekly. Thank you, Dr. Puri.
It as the Journal of Popular Cultures.
Thank you, Dr. Puri, for all that.
Thank you, guys. Thank you.